Let's begin by taking a look at the trigger points that refer pain to the lower leg and foot regions. First, in red, we have the gastrocnemius trigger points. We'll start with the lower medial trigger point, which refers pain to the medial calf and to the arch of the foot. Next, we have the lower lateral gastrocnemius trigger point, which refers pain locally to the upper part of the lateral calf. Next, we have the upper medial gastrocnemius trigger point, which refers pain to the back of the knee on the medial side. And lastly, we have the upper lateral gastrocnemius trigger point, which refers pain to the back of the knee on the lateral side. Now in green, we have the soleus trigger points. We'll begin with the lower soleus trigger point, which refers pain to the Achilles tendon and the heel regions. And next, we'll take a look at the upper soleus trigger point, which refers pain to the outside of the calf. Now in blue, we'll take a look at the tibialis posterior trigger point, which refers a strong pain to the Achilles tendon. And next in yellow is the tibialis anterior trigger point, which refers pain to the top of the ankle and the big toe regions. Now we'll look at, in purple, the peronei trigger points. The peroneus longus and brevis both refer pain to the lateral malleolus. And the peroneus tertius refers pain to the anterior foot and ankle, as well as to the outside aspect of the heel. And lastly, in orange, we have the gluteus minimus trigger points, which can refer pain down the leg into the posterior and lateral aspects of the calf. Here are the clinical findings for the gastrocnemius trigger points. Dr. Travell refers to this muscle as the calf cramp muscle, so most clients will complain of nocturnal calf cramping and pain in the calf, the back of the knee, and the instep part of the foot. Some activating factors for gastrocnemius trigger points include chilling the muscle, walking or jogging up a steep slope or uneven surface, walking or jogging in sand, prolonged immobilization by a walking cast after an injury, tight-fitting socks or garters, wearing high heels, plantar flexion of the foot during sleep, S1 radiculopathy, and a vitamin E deficiency that causes cramps. Clinical findings for the soleus muscle. Dr. Travell refers to this muscle as the jogger's heel. Clients may complain of tenderness in the heel region, unbearable pain when placing weight on the heel, an aching pain at night but not cramping in the calves, edema of the foot and the ankle, and an infrequent but interesting complaint that you might see with soleus trigger points is pain in the ipsilateral sacroiliac joint and the jaw. Many cases of growing pains in children can actually be attributed to active trigger points in the soleus muscle. Some factors that may activate or perpetuate trigger points in the soleus muscle include foot slipping at the toe-off phase while running or walking fast, jogging, hiking uphill, walking or running in sand, wearing shoes with a stiff sole or a non-flexible sole, chilling of the muscle, wearing high heels, prolonged plantar flexion during sleep or with the feet hanging off of a recliner, and wearing tight socks or a garter. Clinical findings for the tibialis posterior trigger point. Dr. Travell refers to this muscle as the runner's nemesis. Your clients may complain of severe pain in the sole of the foot and the Achilles tendon while walking or running, and the pain may migrate into the calf and heel regions. Some activating or perpetuating factors for the trigger point in the tibialis posterior muscle include running or walking on a sloping or uneven surface, eversion of the foot while walking or running due to poor shoes, a tendency to pronate the foot while they're walking, and hyperuricemia or gout conditions. Associated symptoms for the tibialis anterior trigger point are as follows. Dr. Travell refers to this muscle as the foot drop muscle. Clients may complain of pain on the top of the ankle, the big toe, and in the shin. They will also complain of weakness in lifting the foot while walking, which causes their foot to drag. There's typically no pain at night, but they will complain of weakness and instability of the ankle. Factors which will activate or perpetuate tibialis anterior trigger point include ankle sprain, impact trauma, walking on uneven or rough ground, Here are some symptoms that are commonly associated with Peyronie trigger points. Dr. Travell refers to the Peyronie muscles as the weak ankle muscles. Clients will typically complain of pain on the lateral malleolus and the ankle. Foot drop is also possible due to the entrapment of the deep peroneal nerve. Some factors that may activate or perpetuate trigger points in the Peyronii group include twisting or inversion of the ankle, prolonged immobilization by a cast, walking or running on uneven ground, sleeping with the foot plantar flexed or the toes pointed, wearing high heels, a tight sock or garter, and flat feet or unsupported arches. Clinical findings for gluteus minimus trigger points. Dr. Travell calls this muscle the pseudosciatica or side sciatica muscle. Clients will typically complain of pain in the buttock, hip, posterior and or lateral thigh, and calf. They may also complain of hip pain while walking, which causes a limp, pain while rising from a chair. The pain may be constant and excruciating and is unaffected by positioning, similar to that of a disc herniation. Some activating factors for gluteus minimus trigger points include limping because of a lower leg or foot injury, walking or running on uneven ground, intramuscular injection, prolonged immobility, such as driving a car for long distances, true SI joint dysfunction, and sitting on a wallet.